Anteroposterior and Oblique Foot X-rays, Normal Foot X-ray. Normal foot X-ray. A foot X-ray is one of the most basic investigations in orthopedics. Knowing the normal is critical for identifying abnormalities in the X-rays. The two common X-ray views of the foot are anteroposterior, left, and oblique, right. The oblique view is commonly referred to as a dorsoplantar view. The anteroposterior view is often the most common type of X-ray, while anterolateral and lateral views are also performed on the feet. A normal foot X-ray will show a weight-bearing image of the foot. It is best to get a lateral projection if possible. This type of X-ray shows the whole foot in its weight-bearing position. It also helps doctors evaluate the condition of the lateral margin of the fourth metatarsal. The medial border of the cuboid and the fourth metatarsal will be aligned, giving the doctor a better view of the navicular bone. X-rays of the foot are usually a combination of lateral and dorsal projections. The dorsal plantar and oblique views help determine the degree of injury, as well as whether the bones are aligned properly. The oblique view is useful in planning surgical procedures and assessing the results of those procedures. In addition to diagnosing common problems, a foot X-ray can also identify a variety of other abnormalities, such as cysts and tumors, as well as later-stage infections of bones. A normal foot X-ray will show a weight-bearing image of the foot. The image will be black and white, with hard structures and soft tissues appearing white. The X-rays are taken by an X-ray technician, usually in a healthcare provider's office or radiology department. It is important to see 3 different images of the foot in order to rule out any problems. The oblique X-ray of the foot is important for the patient's health and can reveal various facets of the foot. For example, the navicular bone is the bone in the middle of the toes. This is called the navicula. The other phalanges can be seen in a more distorted or twisted state. However, it is important to check all bones of the foot before making any treatment. The lateral projection of a foot X-ray is a weight-bearing image. It is not necessary to remove any clothing or other metal objects. The X-ray technician may ask pregnant women to remove any jewelry or metal objects to prevent the radiation from affecting them. The lateral projection of a foot enables the physician to see the anatomy of the foot in a more detailed way. A normal foot X-ray right uses a lateral projection, which is a more oblique image. A normal lateral projection is a weight-bearing image of the foot. Unlike a weight-bearing X-ray, the lateral projection of a foot can provide more information. In addition to revealing abnormalities, a foot X-ray left can help physicians diagnose a variety of conditions, including arthritic disease. An oblique X-ray can show the bones more clearly and is beneficial for evaluating joint alignment and function. The lateral projection can also show abnormalities of the phalanges, interphalangeal joints, and calcanearism. An oblique X-ray also offers a second look at the navicular bone. If it is irregular, it is an indication of a problem. A normal foot X-ray is essential for diagnosing ankle problems. The image should show 2 views of the foot and be perpendicular to the floor. The X-ray technician should be trained in the proper techniques and safety precautions for the patient. The X-ray will show the condition of the bones in the midfoot. The X-ray will show the position of the lateral phalanges and the peroneus brevis. A normal foot X-ray will show the entire foot and ankle. The lateral column will show the 4th and 5th metatarsals. A tibiofibular oblique view will show the lateral column of the foot. These views are also helpful in diagnosing sesamoid problems. These oblique X-rays are essential for the diagnosis of a fractured toe. Normal foot X-ray, normal foot X-ray, normal foot X-ray.